Good morning and welcome to the virtual vaccination update, a live Q&A with Williamson County Health Department and local health systems. My name is Matt Largen. I'm the president and CEO of Williamson Inc., Williamson County's Chamber of Commerce and Economic Development organization. Our mission as an organization is to drive economic success in Williamson County through connecting, engaging, and activating the business community. We want to bring this timely, important information to you and make sure we're meeting the needs of our individual community members. So if you're not a member of Williamson Inc., I strongly encourage you to join. You can go to our link, williamsonchamber.com/membership, to be a part of our organization. Now, we are and have been an indispensable resource for you and your business throughout this pandemic. So I'm excited about the program this morning. We've got Kathy Montgomery from the Williamson County Health Department, Dr. Tom Talbot from Vanderbilt Health, Nichole Volk from Williamson Medical Center, and Dr. Brian Wilcox from St. Thomas. I have a long list of questions. I hope I get to none of them because the point of this is to be a live Q&A session with our panelists. So the panelists are going to make brief presentations, then we're going to jump right into Q&A. So first, let me introduce Kathy Montgomery, our economic development partner for sure with the Williamson County Health Department. Kathy?
Hey, good morning, and thank you, Matt. I appreciate the opportunity to be here with everyone. I'm gonna wait till you get the slide up. You can go on to the next slide, Abby. That's great. So I want to start by just providing a little bit of information about the state's COVID vaccination plan and how that came to be, because the state actually pulled together a number of health experts who reviewed population data, active case counts, death data, and so forth to identify the phases that our populations would go through, and certainly based on the number of vaccine doses that local counties were going to be distributed to local counties. They created the plan also to meet the needs of our most vulnerable populations to begin with. So, for example, currently we are in phases 1A1, 1A2, and we'll soon be moving into 1B and 65 and over. But we are still currently vaccinating our first responders, our healthcare workers, oral health, individuals with intellectual or developmental disabilities and their caregivers, and currently right now 70 plus. We plan to move into 65 plus as well as school personnel effective Monday, February the 22nd. One thing I do want to mention is that while all counties, at least rural counties, are following the state's vaccination plan, all of our counties are kind of moving through the plan a little differently based on our population size. So for example, some counties might move into phases differently than others, which could be the reason why some of our residents are traveling to other counties and vice versa to receive their vaccines. So in Williamson County, we have a high demographic of 70 plus populations, whereas some of our smaller rural counties may not have as high of a senior population as we do, which is why they'll move a little bit faster into other phases. Go ahead, Abby. So we began vaccine distribution out at our Ag Center on December the 21st. We've been out there since April doing PCR testing and started vaccines in December. From December 21st to at least February 10th, we have vaccinated over 12,500 individuals, both first and second doses. And let me also add that our average per Monday, Wednesday, Friday is 650 to 700 per day. We're averaging about 400 to 500 on Tuesdays and Thursdays. Those are the days that we offer PCR testing in the mornings. Vaccines are definitely free. It's a drive-through vaccination point of dispensing, so you never have to leave your car. And once you're in the arena, get your vaccine, you're referred to a parking area where you can actually register for your second dose on site. Go ahead. Currently, the process that we're using to do vaccine registration is a system called Sign Up Genius. After individuals have entered their information on a priority wait list and appointments become available through Sign Up Genius and through the health department, we actually are moving appointments or moving people from the priority wait list into an opportunity to go ahead and register for a COVID vaccine. This is done either through emails, text, phone calls to individuals, especially those that may not have email systems. So we've been able to contact them through phone calls. They're given a sign up link and an access code to go ahead and register for their vaccine and schedule their own appointment. Once the appointment is finished and we finish the vaccination, we have to enter everything into our Tennessee web-based immunization system called Tennis. You can move on. So that Sign Up Genius format has been what we've been using since December, but I will tell you that effective March the 15th, Williamson County will be moving into a new vaccine registration and administration system. This is a tremendous system. It's going to do quite a few things for us. And different counties are launching this tool at different times. So we're scheduled, Williamson County is, and I will be candid with you, we are in the process of training on this system right now. But actually users will be able to enter their demographic information, be able to choose a date and time for their vaccine appointment. Those who have already registered, though, for a COVID-19 vaccination under the old system do not need to re-enter their information into the new system. We're trying to get through those priority wait lists now before our system goes live. Not only will this system allow individuals or residents to go ahead and register for their vaccine, but the system also tracks, for example, our vaccine allocation to our health department when we receive it. It'll allow us to check those residents in. We'll be using iPads on site, so we'll be able to check those residents in on site. We'll be able to code our distribution of vaccine to the resident, and then the information will automatically be uploaded into our Tennessee web-based immunization system. So the system has a lot of tremendous features that we hope will, certainly improve our processes and make things go a little bit faster for us. Okay. I will say that we are working with some amazing partners in Williamson County, and I can't exclude certainly our local, not only our local hospital with Williamson Medical Center, but also Vanderbilt, St. Thomas, and others who have been providing vaccines for our residents. We're working with our senior living facilities. Mercy Community Healthcare has also been identified as a local provider, and certainly our school districts as well, to try to get people vaccinated as quickly as possible as we move into the phases. I will say that through our partnerships with Tennessee Department of Health and our community agencies, we've been able to form some nurse strike teams that are affiliated both with our state and regional health offices that are currently providing vaccines and will coordinate vaccination visits, certainly to long-term care facilities, assisted living locations, and locations where we might have individuals that experience, for example, homelessness and local jails. We have had experience working with both homeless and inmate populations before through strike teams. During the hepatitis A outbreak, and they targeted sites for this vaccine outreach. So we're trying to obviously get to the populations that are due now, but always doing a little forward thinking about how we're going to vaccinate other populations when they move into that phase. You can go on. And that's what I have right now, Matt. And I think we're going to get through some of the other speakers before we're going to do a Q&A. So happy to. participate.
Great. Thank you so much, Kathy. And thanks for the great job you and your team have been doing since the beginning of this pandemic. I don't think anybody really has an idea of the kind of pressure and stress that you and your team's been under. So Kathy, just thank you. Thank you for everything that you and your team do. It means a lot to our community, a lot to our state. I appreciate it. So next we have Dr. Brian Wilcox from St. Thomas. The screen is yours, Dr. Wilcox.
Matt, thank you for the introduction. And so those of you joining our call this morning, good morning. Thanks for the opportunity to share a few of the perspectives from Ascension St. Thomas. I'm president of our Ascension Medical Group here in the Middle Tennessee area. We've got several hundred providers and clinicians and a myriad of locations providing a lot of service. What I had an opportunity to comment on this morning was just offer a bit of perspective from our medical group and health systems perspective. So with that, I'll run through several slides, and I think the 4 minutes allocated and save plenty of time for Q&A. Next slide, please, Courtney. So just as a brief reminder of where we are in terms of the state, over 760,000 cases of COVID in the state of Tennessee, over 11,000 deaths. We are 5th by state in the number of cases per million of population, 19th in terms of deaths per million, 24th in terms of tests per million, and 33rd in terms of active cases per million. One of the things we've seen that's been interesting through the pandemic was, even though we've had a large number of cases, the mortality or death rate in Tennessee was lower correspondingly than many other states. Next. What we're all enjoying right now is the really sharp decline in the number of hospitalized cases and cases of patients we're treating. And this graph is current through last week. I think these bumps, as you see, or surges, or another word some people use, reflect accurately what we've all experienced over the last 10 months. The good news is we're on a really sharp decline rate. We're really pleased and seeing that in our medical practices, our ambulatory, and our hospital locations. Next. This heat map just gives you an idea within our health system where we are seeing patients hospitalized. So you'll recognize the geography. You know, from Nashville, about a quarter of our patients originate, from Murfreesboro, about a quarter, from other regional smaller areas, and then from outside the area within the MSA often, but sometimes outside the MSA. And I know Vanderbilt's experience has been similar. Nashville's such a hub and source of medical care that multiple states were transferring patients in for a while when they didn't have the resources or capacity. Just to reflect on where we are as a health system, Ascension St. Thomas. So we currently, as of yesterday, had 110 patients in our hospitals that were COVID positive. And this is, despite this scary big number, is a remarkably better number than when we were well over 300 patients. That was when we were at capacity and we're really struggling to manage all the patients that were putting pressure on our sites and our emergency rooms, working collaboratively with our partners in Nashville to care for those patients. We were able to work through this. You'll see this slide representing the breakout by several of our hospitals. And nicely, again, you see reflected the decline of cases, although we flattened out in terms of hospitalizations over the last week. If you have COVID and you're in our hospital, your average length of stay is 10 days, which is up somewhat. And that's really a function of two groups of patients. There's a group of patients that come in for just several days and are able to go home, but then there's also a group of patients that are quite critically ill and stay for a long time. Next. Just reflecting the same breakout by hospital, confirmed cases in-house is the big blue graph, in ICU is the black line, and new confirmed cases, which is the great news, trending downward. Next. This is a reflection of patients tested in our respiratory and testing sites regionally, and this is originating last March. So we have almost a year of data here. The pink you see into the graph reflects the total number of tests, and the blue at the bottom part of the graph shows the positive tests of those patients tested. So correspondingly, as the number of tests go up, we see a connection to the number of positive tests. Our positive rate overall through the entire period of testing is 18%, but in late December and early January, our test rate positive was 35 to 40%. The good news is it's down to the low 20s now. Next. An interesting program that we've had that's kept many of our community members out of hospitals is a remote patient monitoring. So over 2,000 COVID positive patients that we track at home through a smartphone app that we connect to several times a day. Patients are able to interact with us, tell us how they're doing, whether they're breathing with difficulty or what their fever is or their heart rate is or their oxygen levels are. So it's been a nice way to keep almost 2,000 patients that were COVID positive out of our hospitals and provide that resource of availability for other community members. Next. So what we came to talk about today was really vaccines. I said a little of the background. Trusted sources was a question Matt and Abby asked us to address, and I know that Tom and others will have some sources of truth. We really rely a lot on the CDC. The Tennessee Department of Health, as Kathy rightly identified, has been a great thought partner and a leader in that space. And we follow the TDOH or Tennessee Department of Health guidelines in terms of sequencing by age or risk factors. The manufacturers actually are a good source of information, as is our peer review literature. I'm sure Tom will acknowledge some of that because he is one of those peer reviewers. Our national health system, Ascension, is in 20 states and has over 150 hospitals. So we have a lot of infrastructure and national thought leadership in this space, and we rely on that. And then our infectious disease and prevention teams are a continued source of information, and we rely on that. And then we have a lot of collaboration with caregivers in market. So for instance, the Vanderbilt team and our team meet weekly and share information and best practices and try to check in with each other to understand how we're managing in the ambulatory or outpatient environment, as well as in our hospitals. Next. So our experience, and I'm going to touch on this briefly because I know Tom will have a more clinical detail. We are offering the Moderna and Pfizer 2-dose vaccine. That is an mRNA vaccine, and I won't be too technical here, but this is a 2-dose series. The Moderna shot is once given, a 28-day later dose, and then Pfizer is a dose and 21 days later. The hospital, we are hospital centered in our vaccine clinics simply because of the storage requirements that is required for these vaccines. Very cold storage at -80 and -20. The great news is upcoming vaccines like Johnson & Johnson have almost routine refrigeration, a much longer shelf life, and it's a single dose. We're really excited about that probability coming up in March. To be clear, our vaccination, Courtney, back up just a bit. To be clear, our vaccination is driven by supply. We're all really frustrated with the pace of supply. It's episodic. There's a lot of distribution challenges. So we are distributing and vaccinating every dose we received as quickly as we receive it. And we've got a long list of requests in. As soon as we get doses, we distribute them. About 32,000 doses given, 20,000 of those are first doses, 12,000 second doses. And 8,000 of those are to patients and community member doses. So as Kathy rightly identified, really at-risk community members who by inequity or healthcare or social determinants have uneven access to vaccination. We're really trying to work with, for instance, the Housing Authority and other groups in community to offer doses to those either constrained or challenged populations. Next. So a question that had been posed was side effects of vaccines, and I'll touch on those briefly, and this slide's a little busy, but I think what we can say is almost everybody has side effects with the first and second dose. The good news is those are typically well tolerated and mild. Almost everybody, 80+%, almost 90% of people have injection site or arm pain. Fatigue is quite common. Muscle pain or joint pain is not uncommon. And in a general sense, the symptoms are more profound the younger you are and more common after the second dose. But severe symptoms and catastrophic collapses, what we call anaphylaxis, are extraordinarily rare. And in fact, with our dosing, we've not seen that today. Next. An interesting slide, a question has come up occasionally, it may be posed on the chat, is if I've had COVID, do I still need to be vaccinated? And the answer is yes, you do. Here's a slide that shows antibody in orange from somebody who had COVID, antibody in somebody who didn't, and then the first dose vaccine given, you'll see the orange moves up higher and the blue moves up higher. And so if you've had COVID, you do have antibody, but you don't have enough, and we don't know how sustained that would be. And after the first dose, you do produce more antibody, which is a good circulating protein in the bloodstream to fight the virus. And after the second dose, there's a closer approximation of the patients who had COVID to those who had not and received vaccination. So again, you can't escape it just because you've had COVID, but you probably are safe for between 60 and 90 days. We are encouraging all of our community members, our healthcare partners, to accept vaccines once they're asymptomatic, usually 10 to 14 days after they were infected, to receive their vaccine. Next. And then the last slide that I'll close with is just to address the question of vaccination and how it connects to what our other responsibilities are. I think vaccination is a wonderful way that we will use to move through and likely successfully exit this pandemic. On the other hand, it doesn't really excuse or set aside any of our personal and shared responsibilities. So even though you've been vaccinated, you still need to physically distance. You still need to mask. You still need to be aware and mindful of your hand hygiene and placement of your hands to face. You still need to avoid crowded areas. You still need to have time-sensitive testing if you've been in a high-risk environment, although the CDC did change some of those guidelines this week. And again, we really encourage well-ventilated spaces where you participate with entertainment or friends or family. And again, at the end of that shared responsibility, please vaccinate. Our uptake or the acceptance of vaccines in our organization has been uneven. We have over 50% of our associates vaccinated, close to 55%. But again, there's a lot of hesitancy and concerning questions, and we're trying to address that directly. I encourage each of you to be vaccinated because we believe, in addition to these behaviors, vaccination will be a way whereby we successfully exit the pandemic. So with that, I'll just pause my remarks and kick it back to Matt.
All right, great. Thanks, Dr. Wilcox. I appreciate it. And thanks to everything St. Thomas does for the entire Nashville region. You know, in addition to providing great health services, you're all economic development partners. People and companies are driven to locations because of the great health care they receive. So I really appreciate the job that you do, not just during the pandemic, but throughout the year. So next we'll go to Dr. Tom Talbot. He's with Vanderbilt University Medical Center. Dr. Talbot, the screen is yours.
All right, thank you very much for having me join the panel. And it's kind of like a shared therapy session for those of us who have been doing this for a while. So I thought what would maybe helpful, and I can kind of wax a little bit, but just show some statistics. And as I was compiling these yesterday, I was just really struck with, it's been a really long year, and it's been almost a year for us. And we activated our COVID command center on March 2nd in response to both the tornadoes and the first cases of COVID. And we have not closed that command center. In fact, our COVID command call is happening right now. So we are almost to a year, and it's been a crazy year. So to give you a sense of kind of what we've seen across the medical center, and this includes the main adult hospital, which accounts for most of our care and testing, but also our pediatric hospital, our psychiatric hospital, and now our community affiliates in Wilson County, Bedford County, and Tullahoma. When we started testing back in early March, since then, we've now tested over 178,000 patients. Our symptomatic positivity rate is almost right aligned with St. Thomas, with Ascension's, is that we're about 24% for the pandemic, but definitely saw that surge in December of almost a third of our tests were coming back among symptomatic patients positive. And that made us very, very anxious. We do admissions screening and pre-procedure screening, and you see the numbers there, and those patients are asymptomatic. So quite a large volume there. In terms of cases across the health system, we've had 26,551 individuals diagnosed with COVID, and of those, 3,325 have been in the hospital. Fortunately, most have been discharged. We have some in-house right now, and even that number is a little bit high. As of this morning, we have across our center about 45 patients. So definitely dwindling down. We're seeing the numbers go down. And we've had 12% of our population die from COVID. We did see the surges that everyone else saw, and particularly in December into early January. We have a dedicated COVID unit, and by that point, we actually had expanded to 3.5 different units that had our COVID patients across the enterprise at just the adult hospital, as well as a pediatric unit. We also had to open an adult care unit for non-COVID in our pediatric hospital to help care for patients without COVID. So we definitely were seeing the surges, and we're getting very anxious as we were having really close to not having ICU capacity and getting calls from across really far out places needing also ICU beds. So we share the concern that everyone had, and our partners did across the area. We have also been giving the monoclonal antibody treatment, and that's been a lot of work from our teams. And as of yesterday, we've given over 1,100 doses of the monoclonal infusion to our outpatients who are positive and high risk. And we are seeing the benefit that we're seeing in the clinical trial. It was seen in the clinical trials, and that our hospitalization rate is cut over half of what the general population is. And so we are seeing that benefit. It's a logistically challenging infusion to give. We actually had to carve out a dedicated area to give it because most infusion clinics have patients who you don't want to be exposed to COVID, like our oncology population. And so that was a challenge, and kudos to our team who really worked on that and got that up and running. And then I think the true light at the end of the tunnel that we're all very excited about and very relieved about. And we're now about 2 months in of vaccinating individuals. We've given 56,751 doses through yesterday. We have had almost exclusively Pfizer because we do have the minus 80 freezers that allow us to maintain the cold chain. That has led to some challenges, as folks have alluded to, in terms of logistics, particularly as we got into our patient population of our oldest patients and our most frail. Having to get them to a centralized location has been, something that's a challenge that we've been having to navigate. Included in our vaccination, we vaccinated over 18,000 healthcare workers fully and another 3,000 in process. And we started about 3.5 weeks ago patient vaccination. So we've, as of yesterday, vaccinated almost 25,000 patients, as well as some healthcare workers that were not Vanderbilt. So that was our first kind of patient outreach, and 14,000 patients that have been vaccinated at least a dose. And we now, starting tomorrow, we'll start our, Vanderbilt will be covering the Metro Nashville Public School employees, and our partners at HCA will be doing our parochial and private school teachers. So to get those folks now vaccinated. So we're really excited to see that. And I think just as kind of a therapeutic comment, I know that my partners on the call will share that getting the vaccine and getting it into people's arms has been really, I think, the biggest wave of hope that we have seen. And it's amazing what, it's been hard to be at a hospital and a healthcare worker during COVID, especially the front line has really seen a lot. And to see people come get their vaccine, it really is, it's not trite, but it just is very hopeful. And you're seeing people really relieved. So we want to get these vaccines into as many people as possible. We definitely see the hesitancy, like my partners have seen. And in fact, amongst our own workers early on before we had vaccine in November, December, we were clipping at about a 30% stated acceptance rate of vaccination, even amongst people that were on our COVID units and caring for the sickest people, which really made us very anxious. But it's understandable why people were hesitant given everything that's gone on. This is a very success in the scientific world, but fast, so people get nervous. And we really had some success relying not only on our public health partners and our national CDC experts, but we actually kind of comprised a kind of a panel of Vanderbilt experts that would go out and do town halls and answer questions. And we've done scads of these town halls. We've now started to go out in the community, really to answer people's questions. We feel that they've been successful. We've now, our vaccination coverage overall for our healthcare workers is over 70%, and amongst our frontline COVID units up to 80%. So we do feel that that's made an impact to answer people's questions, to reassure them, to be transparent about the data and the science. But I think we're going to be seeing that with our community as we start to work with them, because there is, again, a natural hesitancy. And we just, my wife and I is behind me, she's a vaccine expert as well. We've done town halls every night this week practically with different groups, even outside of Tennessee, to just talk through the vaccines. And I think we're going to need that local leadership as we've been having to kind of get that hesitancy addressed. That's all I have, and I'm happy to hand over the podium.
Great, thank you so much for that. I know we'll have a chance to get to questions. I'm really curious. We'll wait for questions, but the most common question you get at the town hall, we'll wait for the Q&A to ask that. So next we've got Nichole Volk with Williamson Medical Center. In addition to being a great provider of healthcare in our community, it's actually one of our largest employers. So we appreciate everything Williamson Medical Center does for our community and for the jobs they provide to our residents. So with that, Nichole.
We also appreciate our community. That has been what has gotten us through this past year. It's like everybody else has alluded to, it's been a really hard year, and that support from the community has really helped lift us up and kept us going. And we appreciate that so much. Williamson Medical Center tested the first COVID patient in Tennessee back on March 5th, a day we will never forget, that kind of kickstarted all of this. And we've learned a lot since then. I know myself, I've been at the forefront of all the communications. I'm the director of marketing and communications for Williamson Medical Center. And it's amazing all that we've learned. And we couldn't have done all of this without all the support of all of our partners, our sister hospitals, and everyone involved. And it's been wonderful on that front. I think there's been a lot of collaboration, a lot of relationships that have been built that are only going to be beneficial and positive as we move forward in life. And I think that's really great. Kind of looking back on where we've been with COVID and some of the numbers on the Williamson Medical Center front, it's sort of been up and down. During the holidays and post-holidays, we started to get pretty nervous. Our numbers started to look really high, higher than they had been, double, triple what we had seen during the first part of it, but now that's going down. So these mitigation efforts by the community and everyone are working. Please continue to do those. Like you had said before, even if you've gotten your vaccinations, please continue to take all these precautionary efforts. We have to do this to get back to normal. But we started vaccinating our staff in mid-December when we got those first round of vaccines. And it was a lot more emotional than I had thought. I was there, as the communications director, getting all the video footage and the photos and documenting history. And we all had tears in our eyes. It was very emotional. And that ray of hope was just something that over the past year, we really felt and will continue to feel as we are able to vaccinate more community members. And so we are too moving into phase 1B like everybody else per the Tennessee Department of Health guidelines. So we're going to be helping those patients, community members, as we get more vaccines. We'll be reaching out to those 65 and older, teachers, daycare workers, everyone involved. So more to come on that as we get more vaccines. As far as what we've seen on our end, like everybody, with these internal vaccine clinics, we've been able to kind of get our logistics straightened out. Hopefully, as we start to offer more to the community, it's a little bit more of a smoother process, but we haven't seen any major reactions from any of the vaccine doses we've given. We've too have about, I think, almost 60% of our employees, almost 100% of our providers have gotten tests or have gotten the vaccines. And then we've been offering it to a lot of the community physician practices and their workers too. And we've done over 500 for the community physician offices and healthcare workers as well. So that's been really nice to be able to offer that, not only inside of our walls, but outside to all those that provide healthcare as well. We've had one testament to how effective the vaccine is we've had several employees that their whole household has gotten COVID and they had gotten their second dose of vaccine and they did not. So that is something that is just really powerful and kind of talks to that effectiveness. So I think that kind of sums up where we've been and kind of where we're going with all of this. But, we're like everybody else, very much looking forward to getting back to normal, or at least as close to normal, and really getting things, keeping the kids in school and just really trying to combat the economic hardship that's happened through all of this. And I know Williamson Inc. is going to be a great partner in helping to do that.
Well, great. Well, thanks, Nichole. Thanks for making the time. And everybody else, thanks for making the time to be here. I appreciate it. Before we jump into questions, and I hope we can get to all of them. We have a hard stop at 10, so we'll see. But let me ask the first question. Dr. Wilcox, you kind of touched on the trusted sources. Just in case we can't get through all the questions, is there a single source of readily available public data that you would point people toward to basically as that trusted source as we continue to learn more about the vaccinations and frankly about the virus as well?
Matt, I would say the most commonly accessed site and the site that we all refer to most commonly is the CDC. It really is the gold standard nationally and locally. A lot of us have internal documents and connections, but the root of most of the information really originates from the CDC. It's historically been the best regarded organization in the world as it relates to public health and policy. Some of that became more difficult and as this issue was politicized over the last year. Nonetheless, it really stands alone as a source of of aggregating peer-reviewed literature, evidence, science, and then as a result, translating that into policy that we can all operate.
Great, thanks.
Tom may have an idea as well in terms of other sources of inspiration and evidence.
No, you took my answer, and I think if you haven't visited the CDC's COVID website, the content is amplified over the last few months, and the data. They have they're putting a lot more things out there now, so it really does help guide practice and policy.
And Matt, I would say it's accessible and understandable. It's not so scientific that a community member could not get on the site and navigate it successfully and find answers to most of their questions.
Okay, that's really helpful. Great, I appreciate that. Let's go and jump into questions. Also, I want to make a point too that Hannah Bleem with the Williamson County Emergency Management, a great partner of ours in the health department, is actually in the chat too. So she'll be able to answer some of the questions we may be not able to get to. So I'll go ahead and jump into the Q&A. And this was referenced earlier about the speed and the natural hesitancy because of the speed of FDA approval. So considering the speed at which the COVID vaccines were pushed through testing and regulation phases, what sets these vaccines apart from anything else that needs FDA approval? I guess talk through what the speed at which they did it and why you still have faith in the system despite, I guess, the speed that they went through.
I can start. We're asked this a lot, and I think it is natural to have the hesitancy. I think when you hear terms like Operation Warp Speed, the thought is that's really fast, what's cut? And really what we have said to folks are a couple of things to reassure. Number one, people may remember back in 2003, there was an outbreak called Sars that was also due to a coronavirus. It was easier to manage because you were only infectious with a fever. So we could use infection control and basically ended that outbreak. It did kill over 9,000 people. But that scared a lot of folks to say, we could have another virus like this. And so a lot of basic science about how the virus works, how that spike protein that you see in all the cartoons, the red spike, which is probably not really red, but how it interacts and makes you sick, how you actually candidate vaccines against these viruses, so that when COVID came along and it turned out to be a related coronavirus, we had 17 years of that basic science, that if this were a new virus, we would not have had. We would not be where we are right now without that. So if there's a little lemonade from the lemons of COVID, that's a key one. Number two, in the usual process of making vaccines, you have the basic science studies. If they're successful, they're funded. You go to some smaller clinical trials, they're funded. It can take years to do that. And usually the best candidates are selected to do that because it's a very, there's not unlimited funding. But in a pandemic, we can't do that because what if the first ones we picked don't work and we're now back years? We can't wait years for this. So what Operation Warp Speed did was it allowed everybody to go to the starting line. It funded people up to start. They still have to go through the same safety process, the same safety trials and benchmarks for the FDA. Those are not cut. They can't override those, but it got everybody up to the line. And that's why you're now seeing all these vaccines over the last few months come to success, because they all were able to start together. And I think the third piece that actually helped us is that if Pfizer Moderna had come in December to the FDA and said, look, we have a great vaccine that's 95% effective, isn't that incredible? We're all gobsmacked by how effective and safe the study showed. And then they say, well, we don't have any vaccine, we'll come back in the summer after we make some. That's not possible either. So part of the support has been funding up manufacturing before the trials are done. So there are vaccine candidates that have supplies of vaccines sitting in warehouses that will never be used because we can't afford that gap. And that's why when Pfizer and Moderna were approved in less than a week, you were going in the arms of people. So they did still go through the usual FDA process of the safety hurdles. Those were all part of the checkpoint. So those didn't get cut. It was just other things to we kind of played the game, and we had some luck with the virus to help us get to where we are. I think the last point is this mRNA technology is not new. We actually have it. It's used in a therapeutics for some folks with some diseases that make abnormal proteins. And so like amyloidosis is one of those. So we've had this technology as well. So we were able to link the two in the science and jump on in. So I think that's my response to folks. And whether that's a good answer, I don't know, but that's what I say to folks.
Tom, I like that answer. The one thing that I think combines nicely with what you explained that I think is understandable to most community members is we didn't cut any of the steps. We just performed 3 or 4 of them simultaneously rather than consecutively. So rather than just stacking those up one after another, we started 4 or 5 of the process parts at the same time. So everything happened the way it normally would, but it just happened simultaneously. And that can occur when you have literally billions and billions of dollars directed towards something that we've never had before. We've never had a pandemic, so the federal government mobilized resource and applied dollars to process, didn't cut any corners, but just really catalyzed the progress that we were able to show. It was based on solid science, but just happened very simultaneously with a lot of money.
Well, that's great. Thanks for taking the time to walk people through that. I think that's really important for reassurance. I'll go to a question on the chat, but as a reminder, make sure to put the questions in Q&A. So Kathy, this is for you. As a 65 plus individual, how do I join the wait list under the current registration system?
Well, the 65 plus wait list is not actually going to start until Monday. At that time, people can go ahead and register in the VRAS system, that vaccine registration system. If they go to, hang on one second, I'm going to get that site for you. It's vaccinate.tn.gov. So they can go to that site to register.
And will that flip over when the new system comes online too?
Yeah, so that is the new system.
Oh, it is. Okay.
Vaccine registration system. Yes, sir.
Okay. Okay, great. Thank you so much. All right, we'll go back into Q&A. All right, so we'll just take these in order. When do you expect anyone who wants a vaccine to be able to get a vaccine?
Well, I'll kind of answer that. I think it's really going to be based on the number of vaccine doses that different agencies are going to be given or allocated. I will tell you that in Williamson County right now, obviously with our hospitals, Vanderbilt, Williamson Medical, Ascension, and other local hospitals that are providing vaccinations, and as well as health departments, and then of course Mercy Community Healthcare. We're probably the largest vaccinators right now for our county. However, they are continuing, the state is continuing to onboard additional local providers as well that can maintain the vaccine. And I think Tom was the one, and maybe Brian as well, that alluded to the complexity of maintenance of this vaccine, keeping it in that cold storage temperatures and so forth. So we do know that local Walmarts and Walgreens and CVS pharmacies across the state, especially in our really local rural counties, have been, already approved providers and will begin doing providing vaccinations there. We're hopeful that that's going to happen very quickly in Williamson as well, so we can start to get more providers onboarded and get vaccines out into the arms. But as far as knowing when anybody will be eligible to get a vaccine, it's a question I don't think I can answer right now.
Dr. Wilcox, did you want to jump in on that?
Well, I was going to say, I think in a general sense, we believe, especially if another vaccine is approved, and we are hopeful for that to happen within the next several weeks, that we should by midsummer to late summer have ample supply for almost every category of eligible or interested patient or population member. We're going to see a significant percentage of the country that will be hesitant, and I think that will factor into the availability, which will mean for those who want it, it should not be difficult to obtain. So I would think by mid to late summer, that should be easily accessible without any constraint. Tom may have more insight into that as well.
No, I agree. And I think we're going to hit a point, as you know, Ryan, I think we're going to hit a point at some point where we have enough vaccine and not enough arms. So we're going to move from people that really want it and can't get it to, we have vaccine, we got to get in arms, and addressing the hesitancy. I see that that's going to be a tip. Whether that happens April, May, we don't know. And so the goal is just to really improve, reduce hesitancy, and get into arms. Because we know, and with the new variants starting to circulate that are more transmissible, our room for error narrows. And so we probably need more people immune with these strains out than we did before. So it's even more important to get people immune, and the preference is immunity from vaccination, not from infection.
Great. Well, and this is a good follow-up question on this, a good segue. Why is there a deep decline currently, and how do we keep the trend going downward? Do you expect another surge?
That is the question. And I've seen people postulate and have various reasons, and I don't know which one's right, and it's probably all of the above. I've seen that maybe just the stories of the surges and hospitals saying, guys, we really, really mean it, scared enough people. And there are some data to show people did start to do more distancing over the holidays than expected. So maybe behaviors change. I think that's a part. I think I think the early decrease was not vaccination, but now that's going to be helping as more people get vaccinated. And then I've heard an interesting thought that we've been thinking of this in terms of we're all part of the same herd, but we're really probably not, that there's probably several herds, and there's a herd that has stayed isolated and not really encountered people. And there's herds of folks that either have to encounter people or choose to encounter people. And perhaps they've gotten more infections in those smaller herds and not being able to expose anyone who's susceptible anymore. But I don't know that we know. We'll take it. Absolutely, we'll take it, and hope that the variants stay quiet while we get people vaccinated.
Great. Anybody else want? Yeah, go ahead.
Yeah, I would just say some follow-up there is really important. I think the concern we have for another surge, if we use that word, is really baked into this variant virus idea. And so the vaccines are not likely going to prove quite as effective against those variants as it does against the SARS-CoV-2 that we're dealing with right now. And yet our treatment, our way to prevent that is to vaccinate with what we have, so that we've got protected populations that even if it's encountered, it's less transmissible. And that is a way effectively to diminish that risk. So we're projecting that the surge we might see will be likely built into these variant viruses, the UK variant, so to speak. We have real concern with developing in the US, and it's already starting to show some bigger numbers. So again, our response to that should be the same as before, all those behaviors plus vaccination. A lot of comments are offered around herd immunity. And I'd be interested in Tom's thoughts, because he's an epidemiologist in addition to all the other hats he wears. But I think most of us believe that it'll take close to 80% of the population vaccinated before we see true herd immunity, although some of those subsets he described are still in play.
Yeah, Tom, if you want to take that, obviously that's a question that comes up. We hear that term a lot. So what's your thoughts on that?
Yeah, I think, and you hear different numbers. So you've heard 70%, 80%, 85, 90%. I think one big factor are these variants. And if they take more hold, that number is going to go up. And honestly, I don't think anybody knows what the number is. We know it's high. And it's determined by how aggressive the pathogen can spread. So something like measles, which is really infectious, you have to get vaccination rates that are really high, in the mid 90s, to get herd immunity. Less infectious, you have a little bit more bandwidth. So I think that's a piece. I do want to echo one thing that Brian had shown in one of his slides to remind folks. So he showed you the graph of the three curves, remember? And we're really excited that the curve's going down. But if you took the point we're at right now and went backwards, we're basically right now where we were at the peak of wave 1 and 2. So we are not, things will look better. But one worry that I have too is people will see the rates going down and be relieved and will start to relax too fast. I think that's probably what happened between wave 1 and 2. And so that's another thing, is just while things look better, we've got a ways to go. So keep holding tight. No one likes masking and distancing, and I want to go to restaurants, and as everyone does, but we've got a little bit of ways to go. And I think vaccine will get us there healthy, get us there economically, so we can start being back to normal. So
great. So we'll try to get through, like I said, as many of these as we can. We talked about side effects, great chart about the side effects. How about allergic reactions to the vaccine? Is the county health department or hospital system seeing any allergic reactions to the vaccine?
Other than what Brian provided in one of his slides about soreness in arms and so forth, really, we haven't had any reactions. We do have EMS on site at our vaccine site, so we really haven't had to treat or had complications as a result.
I can echo that too. We as well have not had any major reactions.
Great. All right. what are monoclonal antibody treatments? What does that mean?
Take that one. So those are engineered antibodies against the spike protein. So kind of mirroring what you see in the immune response. And in clinical trials, they found that individuals, particularly higher risk, so older individuals or mid-range age folks with certain medical conditions, if they get those antibodies early in the course of infection, it does appear to prevent complications and severe disease and hospitalization. If you give it too late, like once you're in the hospital, once you're sick on oxygen, it doesn't have an effect and may actually be harmful. But what it's basically doing is giving you kind of the antibody before your body can make the antibody. And so that's why it's an attractive therapy. It is logistically a little challenging. You've got to identify folks quickly. You've got to get them there. And again, you don't want to bring someone who's got active COVID infection to any clinic or any place. We can care for them safely, but ideally you don't want them sitting, getting an infusion, exposing potentially other folks. So it's a little bit of a challenge, but I think news has come out this week that we have a lot of supplies of that antibodies that we're not able to use, I think, because of the logistics as much. So encouraging more use.
Great, thanks.
Our
All right,
experience has been positive
yeah.
as well, similar. No, I was going to echo Tom's comments. Our experience with that antibody infusion has been very positive as well. We've seen a marked reduction in hospitalization as compared to the patients similarly ill who did not receive it. So it's been a great resource.
Good. That's great to hear. All right, next one for Kathy. We are 65. Just to clarify, if we are already in the system with Williamson County and we don't get the vaccine before March 15th, will we need to re-register with the new VRAS?
No, sir, you won't. They will not need to re-register. We'll just be pushing still. We'll be trying to get people registered before the 15th. And of course, anyone that wants to go ahead and register in that system, we're asking for no duplications if possible, so that we could go ahead and get people pushed over there and get them registered in that new system. Like I said, we're still going through some training on that, so hopefully we'll be able to accommodate and help people navigate through that.
Great. All right, Kathy, this one's for you too. You said the distribution is mainly through drive-through. Can you get the vaccine without a car?
Well, for the safety of our public, we, like I said, we really are doing drive-through. We can accommodate those. We've had, I can tell you, some 18-wheelers that have pulled up in our parking lot and had to come inside. People that have been in fire trucks and first responders and so forth that have parked and walked in. We can accommodate that. I do know that Williamson Medical Center and Mercy Clinic also have distribution points, as well as Vanderbilt and so forth, where people do not have to have a vehicle. They can just go directly to that center and walk in.
So the suggestion then, it sounds like this person may not have access to a vehicle, is to go to Mercy or go to Williamson Medical Center.
Right, and if we, if the other facilities aren't available, we can certainly accommodate individuals without vehicles as well, if needed.
Okay, that's good to know. Let's see, I think we've already answered this. It's about the wait list. Since my primary care physician is part of the Vanderbilt system, will his office contact me to schedule an appointment for a 65 plus individual?
Yeah, so the way it works is we're trying to get both our own patients and an opportunity for non-Vanderbilt patients to sign up. But in the Vanderbilt system, if you've signed up through the My Health at Vanderbilt app system, you'll get a notification there once you're eligible to schedule. If you don't have that system, our access center is calling folks. We're having to do it in groups. So once we get a supply, we release like 1,000 slots and start calling. And for our next wave of folks, we actually are using the guidance as far as risk factors. So we know who's more at risk will be earlier than later based on guidance from the state. But we hope to get as fast as we can. So either through My Health at Vanderbilt or directly from the access center. Your primary provider may not be able to schedule, but can direct you there as well.
Great, thank you. Is this a one-time vaccination, or will individuals have to be vaccinated annually?
We don't know.
To be determined.
To be determined.
To be determined. Okay.
Yeah. The data on the response, even now months out, it looks promising, but will this be like a flu shot or like a tetanus shot? We don't know.
Okay. Well, and obviously the CDC, we talked about it being the trusted resource. That's a great place for people to check into, that once that information is there, people can access that. Is that right?
Yeah.
All right. So let's see. Question from the public, being able to access this later. Yes, we will send this to every attendee as we try to get to these. Will data in the new tennis database be accessible to new health and vaccine phone apps for travel? Not sure what that means. Kathy?
I don't either. I'm so
Okay.
sorry.
Maybe
Okay.
proof of vaccination. I think travel may require proof of vaccination in either
Oh,
antibody status. So if they
okay.
can access their vaccination record and make that portable, I think that might be the question.
Okay, that makes sense.
I don't think we know the answer to that.
Yeah, we've been working with American Airlines, and there's active discussion of kind of this health passport system that I think the intent is to link in, if they can, with the state registries, because that's the gold standard of if you're vaccinated. So I imagine they're going to have to link with these registries to be able to, but don't know the status.
Right. Okay. Dr. Talbot, I'm just curious, what's the most common question you got at the town halls that you've been doing that we haven't answered today yet?
Yeah, it changes. Early on, it was a lot of concerns about pregnancy and infertility and stuff that was out there that I think we've kind of ameliorated. I think now the question has been, if you could get any of the vaccines that are coming out, which one would you get? Because Johnson & Johnson's coming, and the big answer I say is whichever dose the nurse has right there. If it's Johnson & Johnson, Moderna, Pfizer, all of them protect against the severe outcomes of infection. And the more vaccine we get to folks, so whatever one they have, I would take. I think that's probably been the most common this week, and we'll continue. Johnson & Johnson goes to FDA next week, and so we probably will have that available in, like Brian said, a couple weeks.
And I know you said it was answered earlier, but what about the pregnancy? What is what's the answer? What's the CDC guidance on that?
I got 2 minutes. So in the trial, pregnant women were not, they were screened, but several women got pregnant and they've done well. The animal and regular studies show no toxicity. It's not a live virus vaccine. You cannot get COVID from these vaccines. It doesn't have the things like preservatives you worry about, and it doesn't affect the DNA. So it's very reassuring. And so folks like the American College of Obstetricians and Gynecologists have said, yes, it should be given. And I think most importantly, pregnant women are at risk for really bad outcomes from COVID and outcomes to the baby. And so absolutely, our recommendation, our own obstetricians recommend getting vaccinated. I would as well. So yes, and they actually have started doing studies in the pregnant women to further confirm that. I saw that today. So
great. Okay. Fantastic. And I'll kind of end with this. I know we're headed there. So you talked about, I love the graph about the personal responsibility, community responsibility, and the Swiss cheese, about how all these things build on each other. So how long do you think we'll have to take precautions? And maybe a better way to ask that is, what are the markers that you're looking for that allow us to return to normal?
Let me just start on that and say, I don't think that normal as we define it will return to readily. I think there will be a new normal, and this is, I do think we'll have certain behaviors that will have to be hardwired into our economic and personal lifestyles indefinitely. It is not foreseeable in the next several years that we'll have to eliminate some sense of concern and caution around this virus, notwithstanding the impact of vaccination. So I just think to start to adjust our thinking to, there is a normal coming, but it will be iteratively different than it was when we started.
yeah, and I think there may be some good things learned from this. So, we as a society were really bad about going to work sick. And I think now our perception of doing that in light of that will change. So there may be some things we continue, but I agree with Brian. It's going to be a very measured scale back. Not a switch we flip and we're just suddenly back in 2019.
Right. And are there markers specifically that the public will be able to see when we start to get there?
I think it's going to be vaccination rate and disease.
Okay. That's great. Well, and look, COVID, I think, has accelerated trends we've seen, whether that's in telemedicine, whether it's in personal fitness, whether it's in work from home. We know that it's accelerated trends. I guess time will tell in terms of how dramatically reshapes us as an economy and as a community. Thank you all for making the time to be a part of this really important conversation. Like I said to the attendees, we will send this information, we'll send this program to you. And for those who aren't members of Williamson Inc., we have events like this all the time. So check out our events calendar, williamsonchamber.com. And again, thanks everybody for being on the call. And thank you to our members and our guests for being a part of this very important conversation. Have a great rest of the day.